Oh, there ain't nothing wrong, okay?
Hello, everyone. Welcome to another week's episode of the Black Scientist Cooperative. We have really taken a deep dive into outlining for our viewers the importance of advocating for yourself and for your loved ones. We had the opportunity to hear from the patient perspective, Dr. Angela Anderson, the physician, Dr. Calvin Smith, and on today, we will get to hear the perspective of a healthcare executive, the person who has the utmost decision-making power for coordinating hospital healthcare delivery systems. Here with us today to lead the discussion is a very close friend of mine, and he is from one of the best HBCUs in all of the land, Tennessee State University, Mr. Jonathan Watkins. Hey, Jonathan.
What's up, Sean? Thank you. Thank you so much. Appreciate you all having me.
Thank you for joining us. So we're going to kick it off today by just asking you to please walk us through your career journey to becoming a healthcare executive.
Sure, happy to do so. So I'll try to give you the abridged version because one of the things when I'm speaking at conferences or talking to people, I tell them I'm going to give them the 30 for 30 if you're an ESPN fan or if you're a TV One fan, the unsung version, where I really go into the pitfalls, because if you read a bio, you really hear the trajectory and the success and how great things were. But to really talk to a person and really get into depth about what it was really like, what they really struggled with, what they really fought and had to overcome is a totally different scenario, a different discussion for another time. But I was introduced to the field of healthcare administration as a junior in high school during career day, as of all things. So that's a plug. And if you're ever asked to speak to a career day, please do so and bring your authentic self, because you never know the impact you're having. But I was a junior, and a gentleman, Dr. LaDon Jones, spoke to my junior high school class. And he was a vice president in the Baptist Health System in Memphis, Tennessee, where I'm originally from. And when Dr. Johnson spoke, he had such energy about himself. As a Black African-American man that was strong, that spoke very eloquently and intelligently about what he was doing in the field of healthcare. And I asked him just a couple questions. One, how much money he made. And I was surprised. He gave me a range, a ballpark, and I was impressed. The second question, as a junior in high school, how long do you have to go to school to do that? To which he answered. And at the time, I was thinking I wanted to be a physician, because the standard of success where I grew up at was you either become a lawyer or a physician, for those Cosby Show fans out there. So I decided I was going to quickly change the trajectory and the plan and go become a hospital CEO. And didn't know much about it, but went to my guidance counselor office and went to the library, and they gave me some books and different things to read and encyclopedias, et cetera, et cetera. And I decided I was going to major in healthcare administration. So I went to Tennessee State University, which had a program, in fact, the only program in the state where you could get a degree in there, because out-of-state tuition wasn't an option coming from South Memphis. That just was not going to happen. So went to Tennessee State University and majored in healthcare administration. And as a part of the degree requirement, we had to complete an internship. At the time, Tennessee Hospital Association was promoting its Agenda 21 program, which is a program aimed and geared toward getting more minorities to enter the field of hospital and healthcare administration. I interviewed at THA, and the interview went well. They said, well, hey, we'll send you to Memphis to potentially intern, since we can help defer the cost of housing. I said, great. So I go to Memphis, and when I walk in the interview, who's there? Dr. LaDon Jones, the same gentleman that 5.5 years earlier had spoke to my class. So I told him that he was the motivation, the reason I was there. I got the internship, and it kind of served as a springboard. From there, went on and moved in different areas and got a couple different assignments in different places. But the health system and the individuals that I really credit for my career are Dr. Michael Ugwecki, who's now the system president and CEO of the Methodist Labana Healthcare System in Memphis, Tennessee, and Dr. Jerry Malliot, who was the chief quality officer in the system. Both gentlemen poured into me and mentored me, and I eventually rose to the ranks and became the assistant administrator in the Methodist Health System. Through that role, ended up serving as the interim CEO for a stint, but ultimately became the chief operating officer. Was recruited to go to California to serve as the Kaiser Permanente's chief operating officer for that market. Left there and went to Fort Lauderdale, Florida for my first CEO opportunity with Broward Health. And after a couple of years there, was recruited to join Cancer Treatment Centers of America as the regional president of hospitals and clinics with the Southeastern market. So I've had a number of ups and downs through that entire time, but through it all, I've had solid mentors and good people that have really supported me and looked out for me.
That is an amazing journey. I don't think we've heard anybody whose journey kind of looked like yours, and it's awesome to hear you map that out from being in middle school and being mentored, and then coming up through the ranks for people who kind of shepherded you along. And it's amazing. I there's nothing like it. So to delve into what you do as the end all be all in a healthcare system, I want you to kind of walk us through and help everybody understand how the U.S. healthcare system is intended to work, and how it compares to foreign healthcare systems in other countries such as Canada, or any other region that you think that might be a good comparison as opposed to the U.S.
So I'll try my best, and I laughed or smirked when you asked the question, because if I could definitively answer that, I wouldn't be sitting here having this conversation. I'd be on a remote island with my favorite beverage in hand, and we'd be laughing and we'd be doing something totally different. And I say that because, as a part of my training, I became a Six Sigma Black Belt. And one of the things you learn through Six Sigma, which is this lean and performance improvement certification or project management tool that we use, is a quote from Dr. William Edward Deming. And the quote is, "Every system is perfectly designed to get the results that it gets." And I say that to say that the U.S. healthcare system is probably no different. It's a very fragmented system with misaligned incentives for individuals. So it creates this broken process that many of us, and we watch people try to navigate and experience. And what do I mean by that? So you have payers that are incentivized to keep as much of your premium and money in their coffers as possible. You have physicians that are tasked and charged and who are incentivized to perform as many procedures and tests and et cetera as possible. You have hospitals that have a dual, incentive in that we want you to come, we want you to get a high-end procedure, but we want to get you out because we're reimbursed on what we call a DRG, a diagnosis-related group model, where there's a cap on if you're going to come in and be admitted for COVID. I'm just throwing something out there that I don't think there's a DRG for COVID right now, but COVID, you're going to come in and the DRG says they're going to pay us $5,000 for a 4-day hospital stay. On average, we know what it takes and what it costs us to provide you care. You're going to pay us $5,000. It probably costs me $4,000. I have a $1,000 profit margin. My incentive is to try to get you out in 3 days, increasing my margin, improving the quality, and maintaining the quality, while at the same time not letting that eat into that capitated rate I'm going to receive for that reimbursement, for that treatment. You juxtapose that, so you got those. That's for a commercially insured person. You have the VA, Veterans Administration, or Veterans Affairs, depending on who you ask. That is a separate system where military individuals, veterans, and so forth can go and receive care. And then you have the uninsured population that rely on your community health systems, your federally funded, FQHCs, federally qualified health centers, to support and treat them, each of which are totally, different in their approach. They're incentivized totally different, and they're funded totally differently. You juxtapose that to Canada, for instance, that has a single payer health system where everybody receives the same quality of healthcare, the same type of healthcare at the same place. That in and of itself is a less of a financial burden on the country and the economy there. Their outcomes, when you look at the data and life expectancy and so forth, are improved. And if you were to ask, individuals, depending on where they fit in their socioeconomic realm in society there, would say it's a better situation because it's one in which everybody's looked after. So in a word, our system, or a couple words, are fragmented and broken. Theirs is much more aligned with healthcare for all, for lack of a better way of putting it.
I think you raised some really great points, Jonathan. One of the things that I want our viewers to kind of take away from what you just said is that healthcare is a business, right? And I don't know that, patients, when they're coming to the hospital especially, or clinics when they're sick, I don't know that they make the connection that healthcare and hospitals are a business, and that these things that you just mentioned are considerations that are taken into thought when they're being treated, if that makes sense.
It does. No, you're absolutely right. I'm not sure how many people take that into consideration either when they're seeking care and treatment. And it's unfortunate, though, that they have to even think about that when they're coming in, because I tell patients each time, in each organization I've worked in, I've always tried to connect with the patients, whether it be at orientation or at any form or setting that I'm speaking with them in. And one of the things I'm always mindful of and remember is that nobody wants to be there. We're probably the only, one of the only organizations or health systems or entities in which individuals come to, and we know there is nobody, for the most part, there are some elective cases and procedures that people will seek out, but nobody wants to come into a hospital. So as we interact with patients, we have to keep that in mind, understanding that, yes, it is indeed a business with different people, with different incentives that are all working to achieve their targets and their goals, but you couldn't be more accurate, and that many people don't realize or recognize that.
Exactly. And then just one other thing that I would add to, for our viewers is knowing that this is a business, then they need to place themselves in the position of the consumer, which means that they have choices. And so, in our previous episodes, we heard from a patient, we heard from a physician, and one of the things that the patient mentioned is that she was advocating and trying to tell a physician how she did not feel well, and they were dismissive of her symptoms, of how she felt, et cetera. And her husband was a doctor. And so she ended up having to go to a totally different place, which is unfortunate, right? But our viewers need to know that because it is a business, they have options, right? So if you're not receiving treatment that you feel is appropriate, or care that you feel is appropriate, or the physician is not empathetic and not giving you equitable treatment, then you have the opportunity to go someplace else.
Oh, without a doubt, definitely. So I encourage patients and individuals that are consumers, and we use that word, and I like that choice of words, often to put themselves in a position of power in the industry. And I'm going to be giving away a couple trade secrets, but because I value and love this topic, I'd be remiss if I didn't bring it up. The first is taking advantage of those surveys that you fill out. So as a hospital and healthcare system, I'm reimbursed on what we call the value-based purchasing system. So my reimbursement is tied directly to a couple items. The first of which is quality, the outcomes. Are patients receiving the outcomes and the services in which they were intended to receive? The second is patient satisfaction or customer or consumer satisfaction. Those surveys that they send and that you get to complete, they dictate and play a part in the reimbursement that hospitals and health systems get. And you should be mindful of that, so that when you are at the end of and as you exit treatment and as you are getting those surveys, if you can slightly mention that you will be completing yours or filling it out, people recognize then that you're an informed consumer. And right, wrong, or indifferent, informed consumers are treated differently. So I encourage people to understand the system, know their rights, know the role they play, and not only to be advocates for themselves, but also leverage patient advocates. Each hospital and system I've worked in, we've employed patient advocates to do just that, to be the patient's voice, to speak up when they can't or won't speak, to articulate their concerns in a manner and way in which that will get through to me, that will get through to the physicians and so forth. So again, you're absolutely right.
I need to start taking more time and filling out them surveys, because
Me too.
as many times as we've had hospital stays, without fail, you get the call and you answer it, and they'll ask you about taking a brief survey. And, for the most part, you're more likely to fill it out if you've had a bad experience. And that goes for restaurants, right. That goes for,
That's
stores and everything. But I think it's important to fill it out whether you had a good experience or a bad experience. All of it is feedback that can come back in to help improve care. So.
Yeah, I'll be honest, I never really saw those surveys as a way to advocate. And now having just heard your explanation, like all the lights went off in my head, like, man, I always throw them in the trash.
Yeah.
Right. So again, another one of those trade secrets. I can tell you, we've done study and spent countless dollars just really evaluating and analyzing the patient. So I can tell you within a certain degree of confidence who's going to complete the survey after 5 minutes of talking to them. And certain clinicians can, certain nurses can, certain physicians can. So who do you think gets the oil or the attention in that scenario? If your call buzzer's going off and, patient A's call buzzer's going off, and I've already in my head surmised who I know is going to complete the survey, where do you think the attention's going?
This is so juicy.
Yeah, that's good information. And that's what we need. Those are the types of things that we need to know. I can bet I filled out 0 surveys. 0. Good, bad, or whatever. I probably never filled out one surveys.
And I'm on the other side of the spectrum. I fill out
happens all the time.
We know you fill out all the surveys, Charlene. we got it.
Right.
For sure.
We know Charlene fills out all the surveys, and she writes comments.
I know.
And she writes comments.
I do.
And we appreciate that, because and I truly take the comments and the surveys as an opportunity to learn. I tell people all the time, I speak at new patient orientation every morning to welcome our patients into the facility, because I recognize, as you mentioned, they have choices. So I thank them for selecting CTCA to walk with them and fight this battle, walk with them through this fight and this journey with cancer. And before exiting, I give each of them my personal cell phone number. And I don't have a burner. I don't have another phone that they get. They get the same number that Sean had. And they get the same number that anybody in my friends or family members can reach me on, because I firmly believe and want them to be able to have access to me. Because if we can address a complaint before it turns into a grievance, we win. With a complaint, you can turn it around. But a grievance turns into that written communication that they send you, that by virtue of CMS and federal mandates, you have 7 days to respond within. and you try to keep all grievances minimized and just simply address a complaint and turn it around. The other reason is because, as you said, I know patients have a choice. And if they visited me in Atlanta, my facility, and have visited Emory, and they're deciding where they want to get their cancer treatment, I firmly believe that the fact that they now know that they can text or call the CEO if they have a personal complaint gives me a leg up. Because I've never worked in any other hospital or visited one, and you all can tell me outside, unless you have to know that person personally, where the CEO literally visited the facility orientation or wherever and gave every single person in the room his cell phone number. So it's those types of things that I aim to do in my organization and push others to do as a way of advocating or establishing a form of advocacy for patients and their caregivers.
So, Jonathan, I mean, this has been enlightening, and you've changed my thought process about taking those surveys. But, okay, so where else in this can patients, where else should we look for places to advocate that? Like, clearly a lot of us, other than Charlitha, of course, thought nothing of those surveys, but we see how important they are, right? Where else do we as patients fall short? And then, or what areas of the healthcare process might we miss? And that sort of leads us into this inadequate healthcare, like you just mentioned before, between patient A and patient B, who you've determined which one is going to submit that survey. What other things can we do to up the ante in terms of the care that we receive?
Yeah, great question. So I encourage and really believe that we should take advantage of that phrase that every physician asks, whether they mean it or not, any questions for me. That's the biggest way right there. By truly having the physician or the clinician or whomever's in the room with you take time and really get an understanding of what they're saying, what they're telling you need to do, what they're saying to you about your medications. I don't know, I mean, as physicians, clinicians, educators, and individuals that are probably viewed and looked at by your families as the ones to go to with doctor in front of your name, how many of you all get the call when a family member leaves a doctor's office or a clinic or any interaction wanting your advice and input?
Yes.
I don't have doctor in front of my name and I get the phone call. So I can imagine that you all get it.
Yeah.
Because and we know they had the time, and we know somebody asked them, but they didn't push forward. So that's it. I mean, us not being afraid. One of my favorite books is Outliers by Malcolm Gladwell. And he talks about the socioeconomic status playing a role in that, how those of us that grew up either in more affluent or even middle class homes and areas were taught to inquire and ask questions of physicians. And he gives a specific example about a little boy that's going in for one of his first doctor's appointments and how his mom educates him on being comfortable asking questions and making sure that he knows, for lack of a better phrase, he's in a position of power, that he's a consumer and he should be treated as such. We don't do that often. We go in and for fear that we're either going to appear a certain way or get shunned or whatever it may be, doctor will ask, we'll walk out of that office or that clinic and that building with no real clue of what is meant and what we need to do to better take care of ourselves. So I would say definitely take advantage of the time. They're in that room with you. Get your questions answered.
Good. Now, another thing that we tend to deal with as patients is implicit bias. And so we talked about this again from the patient perspective and from the physician perspective, like we mentioned before. So from your perspective as an administrator and an executive, what do you see us doing to combat or to really address implicit bias?
So again, from an executive space or a hospital administrator standpoint, it's really working toward educating my team on that bias and that it does indeed exist. And that's the first step. And from there, identifying individuals, organizations, and so forth that we trust to train us, to educate us on how we overcome them is one item. Combined with that, you work towards creating and crafting and surrounding yourself with a diverse population of people that aren't necessarily, that are both on the front line providing the care, but also in the front office making decisions and leading. It's through that you can sometimes overcome some of that. The patient advocates that I mentioned earlier, they are trained on it, they're educated on it. So leveraging them to kind of help you talk behind the scenes on some of the decisions and the thoughts that you probably are having. But it's first through recognizing it as an individual or as an executive, and knowing that even that I have them. Being a minority does not remove them from you. We all have them. And the minute you know of them, you can start to make steps and make changes. And then you can also surround yourself, again, with a diverse group of people whose biases probably are different than yours. And there's a hope that somewhere in there, if you again have a team of individuals that are comfortable with uncomfortable conversations at times, and they're comfortable with conflict, that you can make decisions that are ultimately the best for the patient and the organization.
And along these same lines, when you mentioned earlier that within 5 minutes, you can discern if a patient's going to, and we're just kind of using the survey as an example. But what are the characteristics of the person that you determine that's going to complete that survey? What are you looking for? Like, what are those things that you're looking for that lets you know that this person is more likely to do it than not?
They first ask names, and they want to know names. They're going to remember names. The way they look at my badge, they internalize it. They take it in because they want to know to reach me. Or the way they look, or even if I'm not who I am, but they look at a person's badge because they're going to remember who they talk to. They ask questions about the care. They'll sometimes reference knowing about the survey, knowing patients' rights, just their experience in healthcare. They're engaged. They're not, you can't just order that person around. They're not just going to simply listen and go and do as you say. All those items, and again, it has nothing to do with race at all. Because again, we have 25% of you on this call complete the survey. So it really is, I would say, an engaged consumer that by off the rip is going to type in, call you, text you, reach out, and they want to have those names because they're taking notes. Because you got to remember, so I'm in a single specialty hospital right now, a cancer institution, where the specialists are oncology experts, and the average consumer is not. So they're writing things down as the physician's talking. They're making sure because they're going to hold us and our team and the physician accountable. So within, again, certain degree of confidence, I know that person will write a letter, will call, will complete a survey, good or bad, not just bad. They're just going to go after it.
That's true. That's 100% true. So, we talked about how, healthcare is a business. And during COVID and the pandemic, some businesses had a boom, right? They made billions of dollars. It was very lucrative for a subset of business where it was detrimental for others. So I just want to get some feedback from you on how the healthcare landscape changed in America in the face of the global pandemic, And, what do you envision as our new normal? Because, there were the CARES Act, and, people are counting on those dollars, but I'm not sure how long those dollars are going to hold up and when the well is going to run dry.
Yeah. So let me first say that the healthcare industry suffered. We did not make billions, but the insurance company, going back to the very first topic we talked about, profited big time. UHG, United Health Group, annual in 2019 profit or margin and net revenue went from 3.7 billion pre-pandemic to, if I remember correctly, 6.5 billion. It may have been Cigna. I won't say the name of the payer, but another payer went from 1.1 to 2.3 billion, all because we couldn't have the elective cases. Anything that a patient or an individual wanted or still wants right now during COVID has to absolutely be an emergency. I was meeting with physicians from a health system that are interested, because my hospital doesn't have an emergency department. We're a single specialty facility. We hadn't been overrun and bombarded with COVID that way. They're interested in bringing some of their cases and performing them at my hospital because they literally can't do anything that's not an absolute emergency. And you probably didn't ask this, but I think about it even on a grander scale, because if I'm, the 60-year-old that has joint pain in my hip, and I need and want a hip replacement because it's painful. No, it's not an emergency, but it's painful enough to me that what can start to happen? Pain medication, narcotics. I mean, all these different things can continue to grow during this deferral of cases that hospitals are having to do. It's not by choice that they're having to do this, because it's destroying their profit margin, but the safety and whatever your political beliefs may be about it, the vaccination and the masking and all these different things are ways we know keep people out of the hospitals. But without them, you ultimately end up exacerbating the services that are currently right now in the healthcare space. But in terms of where we are and where we're going, the bright light is that it did call for innovation on our part. And so we expedited telehealth, telemedicine. Mm-hmm. We expedited the use of remote patient monitoring to stay connected with our patients. So through this same medium, whether it be on the phone call or a FaceTime or a Zoom, a physician can now have a conversation with you, can e-prescribe a medication for you, can actually see you through wearables. They can get your vitals and different signs and so forth without you having to go into the building. I think those things will continue to advance, and we'll double down there. And it will help in the long run as more and more people that live in rural areas that can't necessarily access high-end healthcare services will be able to connect directly to a top oncologist or a top cardiologist that probably wouldn't work or want to live in their market because it's not as lucrative for them. So I do see that as being the light at the end of the tunnel.
Jonathan, I think one of the things too, one of the key takeaways that I like our viewers to understand from like what you just said too is that healthcare suffered and healthcare hasn't recovered yet either.
That's correct.
From a market perspective, what are your thoughts around the quality of healthcare post-COVID? The reason why I'm asking this question is I had a loved one that was hospitalized not too long ago and had a biopsy, and where normally it takes 3 to 5 days for a biopsy to come back. In his particular case, it took months, like over a month,
right,
for the preliminary results to come back. And so I think it's important for our viewers to understand that healthcare hasn't totally recovered, and even more of a reason why advocacy is needed, because the service lines are not, back to where they were pre-COVID. Can you maybe speak to that a bit?
Yeah, no, certainly. So in addition to the natural delays you're just going to experience when you're being overrun and overburdened like that, we're experiencing, like, again, most industries, a shortage in personnel to complete the test, to draw the test, to run the test. And because not every lab was perhaps doing COVID testing and so forth, and with elective surgeries that they were probably getting most of their diagnostics and their images and so forth, not the images, but their specimen from, were being limited, they were having to shutter and shut down. So you have fewer people doing it, you have fewer options to send them into, which naturally exacerbates and just stretches that time frame out. All those things are going to really impact the quality, making it much more important for you to stand up, be very vocal about what you know, you believe and deserve, what you want, what you expect, and really promote and push for it. It's not by choice that these systems, I will say that, in many instances are delaying the results, but it's really just a matter of where the industry is right now. In many instances, when we look at healthcare, the profit, and I hate to say it this way, is in the treatment. So my inability to treat is destroying my profit margin. So there's nothing about that's a choice, but it's really just a matter of, again, what services are available and what resources I have at my disposal.
Wow. Well, Jonathan, you have given us an education on this evening. We appreciate you joining us on the podcast tonight. It has been an eye-opening experience. I like to always just kind of reiterate for our viewers what we learned tonight, all of us, what we learned tonight. One, healthcare is business.
Survey.
Well, that I was gonna get to fill out the survey. One, healthcare is a business, right? Two, you are a consumer of those business services. Three, fill out the survey, because in addition to advocating by the bedside to the physician, to the nurses, you advocate through the documentation, which is the survey, which, describes your experiences. And last but not least, it's critical to be even more vigilant now, just because of the current state of healthcare. It has not recovered from COVID. COVID was a huge hit to the US in general, to across industries and across, markets. And we're building back and we're working towards recovery, but we're not there yet. So it's critical for patients to advocate for themselves now in this current environment, even more than pre-COVID. So
absolutely,
if you take nothing else away from the conversation tonight, take away those things. Take away those things. So thank you for coming, Jonathan. And thank you, viewers, for joining us. And we'll see you on the next episode of the Black Scientists Cooperative. Good night.
All right.
Good
Thank you
night.
for having me. Good night.
Deep flows like a breeze flowing through me, from my head to my feet. Your love runs smooth, ooh, it soothes, and you're making life bright. I'm so glad that you're mine. You're mine. Yeah.